Thank you, Violetta. Thank you, Hani. Thank you, Birgit, Belen, for inviting us to this mHealth Hub and being able to share what we have done in Germany, and also thanks to Dan showing us once more the impressive example, I think, from Estonia. Actually, I'm already interested in what you have presented on your solution with regard to the sharing of positive keys with the Estonian Corona warning app.
We are isolating different biocompounds that have antimicrobial, antifungal activity, anti-cancer activity.
I think this conversation is not linked. We should mute this attendee.
Yeah.
Thank you.
Can I continue?
Yes, please.
Okay, great. Yeah, yeah, the Corona warning app, it's indeed a challenge. How can we improve the positive rates of users sharing their codes? We have around 60% of users, once they get a code, sharing their keys. We have 15 million downloads, and there is also integration to the labs. But it's indeed a challenge, and I would be interested afterwards to hear more about it from you, Dan. Also with regard to the consent of the users. But anyhow, in the next 50 minutes, we are now, we want to show you, Lars and I, how we approach from a regulatory perspective the reimbursement and the integration of digital health in Germany. I put the next slide on. I hope you see it. There you go. The German health system is a statutory health insurance system. As all over Europe, there are certain challenges, demographic challenges, and then mHealth is part of a overall digital health policy to improve communication, efficiency, etc. There are not so many policy instruments to make the system ready for the future, and then digital health is a part of it, and mobile health. And indeed, as Birgit pointed out, Corona very much showed us how digital health can help the system to be more resistant for health crisis, in particular in the area of telemedicine, which we have seen a huge plus of demand in Germany and usage of telemedicine services, also including mHealth, and then also the area of data collection. And actually, for us in Germany at least, it proved that it would have been better if we would have been more ahead in our agenda, which we, however, in the last years we have accelerated much more the policy push for digital health. So with regard to mobile health, we started around 2015. I think there was already a working stream on telemedicine. Then the technology, let's say, lines got blurred, and then it got more into the area of mobile health. What do we do with the health apps? How can we approach this from a policy perspective? So what we did was we started talking with our stakeholders, and we also financed what you usually do as a ministry. You finance a study. You try to understand the impacts, the challenges, also the benefits, of course. And then the three elements which came out of this was that we need more transparency and quality. We saw a huge market of these apps, But also the differentiation or the variety of quality was very broad, let's say. There was a need for more orientation for patients, but also doctors. They needed more orientation to know what they can use, what they can recommend, what is a health app which is of good quality. And then, of course, in Germany, this is key, also the question of access to the system. Since the German patient insured person is used very much that the system pays for it, there is, of course, on the second health market or the private health market, there was let's say a starting for this, but in the end, if we want to integrate this in the German health system, if we want that the German statutory health insurance system makes use out of it, we would need to provide for access, and then we came up with a certain with several legal acts. In 2019 and 2020, we are also having currently an act in after cabinet, which is going into the parliament, which even provides for further developments. And yeah, so in this regard, we didn't predefine as we do as the regulator certain areas, but we provided for an legal access procedure, which is a formal way of then to providing for transparent access. And here I think Lars can take over. Thank you. Lars, to you.
Yeah. It should probably work now.
Perfect.
Yeah, let me see if I can fix the. Yeah, now it should work. Can you hear me?
Perfectly.
Great.
Perfect. Yeah, I have to start with an apology. As it's kind of ironic that I can offer audio only, and that the quality of the internet already decreases at the outer boroughs of Berlin at a rather dramatic pace today. So I'm glad that I can be with you at least via audio. What I would like to do is, yeah, as Niklas already pointed out, I would like to give you some details on the way we, or on our approach to facilitate the access of mHealth innovations to the statutory health insurance system. And in particular, how we try to enable a system, and that's why the picture of Bismarck is here, a system that has been created, or that was created in the late 19th century to keep up with the fast pace of digital innovation. We did that in a way that somehow reflects certain characteristics, and I will talk about the interaction of stakeholders at a later point, but also added some new elements to and new structures to new mechanisms to evaluate digital health applications. If you're a German citizen, Niklas already pointed out, you're used to receive or to certain entitlements. Your statutory health insurance fund will pay for treatment in hospitals. It will pay for medical aids. It will pay for drugs. And what we did was to create a new entitlement, which basically grants the individual patient, the individual citizen, the right to demand to be treated by digital health applications. What is a digital health application? If you could, yeah, thank you. A digital health application, and that's probably how we define mHealth in Germany, is an app. It's a browser-based web application that fulfills certain criteria. We're focusing on medical devices, lower risk medical devices, class 1 or 2A, in accordance with the Medical Device Directive or Medical Device Regulation. You need to fulfill certain purposes, such as support the recognition, monitoring, treatment, or the alleviation of diseases or injuries and disabilities. You need to be, the main function of your app, your web application needs to be based on digital technologies. And that's very important. It needs to be a tool that is used by the patient, in the hand of the patient, or in the interaction between healthcare provider and patient. In order to be eligible for a new procedure, or in order to be prescribed by doctors, or prescribed by doctors, you need to fulfill, of course, certain requirements. You can see these requirements on the right-hand side of the slide. These requirements are, of course, safety and performance. You need to fulfill the requirements of the respective medical device regulations or legislation. You need to adhere to the legislation that guides data protection and information security, and you need to fulfill certain or further predefined quality requirements, medical quality, technical quality, access for persons with certain disabilities, and other aspects. And you need to be able to provide evidence in the form of a positive healthcare effect. I will talk about the positive healthcare effects in a second. Let's have a look at the interaction of the stakeholders and the procedure. The procedure we've created in order to verify if a digital health application can be paid for by a statutory health insurance fund is rather new to our system, as the time frame from application of a manufacturer and introduction in the statutory health insurance system is limited, or it takes 3 months only. So if you develop an app, you can go to our Federal Institute for Medical Devices and Drugs. You apply for listing in a directory that is run by the respective authority. You provide your information, you provide your evidence. The information will be examined by the BfArM, and then if everything is fine, you will be listed in a registry. And once you've been listed, after 3 months, you can be prescribed by apps, and the statutory health insurance funds will pay for it. So one of the main actors is the BfArM. Other roles are attributed to the National Association of Health Insurance Funds and the national and the associations of manufacturers. They create a framework agreement on pricing, and they regulate the price, they regulate the price pertaining to this framework agreements contains regulations concerning the price in the first 12 months of reimbursement, and in the in the 13th month, after the 13th month, tongue twister. In the first month, the price that is paid for is the manufacturer's price. After the 12th month, there is a negotiated price between the National Association of Health Insurance Funds and the individual manufacturer of the health app. What is probably the most important fact of this procedure is the fact that you can provide evidence at 2 stages. You can provide evidence on the positive healthcare effect right at the beginning, or you can ask for a preliminary listing and provide and collect and provide and produce evidence in the first 12 months of reimbursement. What is a positive healthcare effect? A positive healthcare effect is, first of all, can be a medical benefit, mobility, influencing or an influence on aspects such as mobility, mortality, and quality of life, or it can be something that we call patient-relevant improvement of structures and processes in healthcare, further HTA aspects that we've somehow or that we consider to be important and somehow characterize the benefits that these digital innovations have for our or can have for our systems. As we're running short of time, I think I should leave it here. It's rather a short, a tour de force, but if you have questions, of course, we'll be there at the end, and I will turn to Niklas.
Yeah, thank you, Lars. I think you pointed out rightly the procedure. I hear my voice in the back, but I will continue talking. I don't know if somebody could mute his phone.
Try now.
Okay, I tried to.
Yeah.
Okay, I tried to continue. So anyways, I think we were at the end because you also asked for the physician's role. Of course, they have a very crucial role since they have to prescribe, first of all, the apps, but also they, we also, I think this was also what we mentioned towards you as an mHealth Hub. We think also there's a special role for the medical health societies in labeling the quality of those apps. If we talk about European quality criteria, I think this is something we should take a look at. There was also in the past some efforts on EU level by following a green book. However, unfortunately, due to certain factors, there were no results so far, but this is something you can maybe take a look at. Also, by the way, if it comes to a code of conduct on privacy, which is still very much needed to have such a pre-criteria, the physicians in either way have a very crucial role. And what we are also trying to further do is tackling the issue of interoperability towards the physicians' IT systems so that they can easily see and have a linkage to the directory. If you want to have further information, we recommend to you the BfArM guide, which is also in English. And with that, Lars and I can finish. Thank you very much.